Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Dr. Tighe, a physician, an ER physician here at Cullman Regional. Welcome to the podcast.
Yeah, thanks.
Yeah, I'm excited to have you here. Before we dive into talking about heart attack and stroke, give us a little high-level view of who you are and kind of your journey to get here to Cullman.
Sure. Yeah, I came to Cullman about a year after my residency training, and I've been here for about 7 years and been the assistant medical director here for Cullman for about the last 2 in the emergency department.
Yeah, and so, heart attack and stroke is a big topic of discussion. There's a lot we can talk about. I think we're going to dive in and talking a little bit about heart attacks first. Help the audience understand what happens to your body during a heart attack and why it can be deadly.
Absolutely. So, heart attacks basically decrease blood flow to the heart by various different ways. But, we all think of somebody clutching their chest and sweating and having significant pain. And, time is tissue with heart attack. And that's why we always, anybody with chest pain and that sort of thing, want them to come straight to the emergency department.
Yeah. And do you typically see a sort of like an age range where heart attacks are more common, or can it affect really any age at any time?
Sure. So typically it's a little older age group. We start seeing it normally in the 50s, but it can happen to anybody. It can happen in your late 20s. If you have some other medical problems, but usually folks that, are hitting their 50s with a history of high blood pressure and diabetes, some other risk factors. And that's when we really start seeing it significantly.
Yeah. And so heart disease is one of the top leading causes of death in the United States. What leads to heart attacks? And is there sort of other health concerns that maybe make you more prone to potentially having a heart attack?
Yeah, that's a great question. And, high blood pressure can cause some strain on your heart over a period of years. High cholesterol, smoking is a big one, as well as diabetes. Those are all risk factors that kind of increase our risk for heart attack, as well as, kind of sedentary lifestyle, someone who's not, exercising quite as much and that sort of thing.
Mm. If someone's experiencing some of the symptoms maybe associated with, chest pain or any other things that kind of associate with heart attacks, what should they do when they experience these symptoms? Is it an immediate call, or is there sort of a kind of a level or stages of kind of what they should be prioritizing for their health?
Sure. So that's a great question. Anytime we have chest pain, 911 is a call, and we have a great urgent care at the hospital, and they do a wonderful job. These are one of the few times that, you're experiencing chest pain. It's an ER type visit. That's the best care we can get. And, if you're at home, it's a 911 call for sure.
Yeah. And so when patients come in, either a 911 call from home and they get brought in by ambulance, or if they come into the ER themselves with kind of chest pain on maybe the way home from work, what is sort of the test that you run to determine whether or not it's a heart attack? And is there results that you get that maybe that you more commonly get that's not necessarily a heart attack they're having, but they're having something else?
Absolutely. A good question. So anybody with chest pain, especially as an adult, coming to the ER, there's a lot of quality metrics across the U.S., and we're doing very well with those about getting an EKG or electrocardiogram. It's just kind of a pulse of your heart. They put little stickers on your chest, and they'll have somebody come out and grab you out of the lobby and do that really quickly as a screening tool. That, along with some cardiac markers called a troponin, which is basically testing any kind of leakage of heart tissue into the blood. So, there's a couple of different things as well that we can quickly screen. Other things that can mimic, heart attack would be you can get chest pain from pneumonia, you can get chest pain from a collapsed lung, and all sorts of different things. But we're really quick to get that EKG or electrocardiogram when you hit the door at Cullman Regional.
And so if the tests come back and it's positive for being a heart attack, what is the treatment process for that patient? While they're here in the hospital, while they're here in the ER, and then kind of that post follow-up appointments that are associated, because typically, it's a 3-4 month process, or even over the course of a couple of years, you're going in on a regular basis to make sure everything is looking okay for the cardiologist.
Sure. And most of the folks that have a heart attack don't need immediate stent intervention where they go in and put a little stent in your heart. Most of them are what we call like an end-STEMI, and I won't go too far into that, but a lot of times we'll get the cardiologist to see them, and they'll get an ultrasound of the heart and check on some different things. They may do provocative testing, such as a stress test or a cardiac cath, where they can kind of look into the heart a little deeper than we can in the emergency department, and usually put people on some blood pressure medicine, cholesterol medicine, and kind of the plan from the heart doctor. So it can vary from, hey, we're in full fire alarm mode, and we're running around, and hey, you need to get to a heart doctor now who can place a stent inside your heart. And that's the minority of the events. Most of them are, we get admitted to the hospital, check and see what all your labs are, check an ultrasound of your heart, and kind of medically manage the heart attack event.
Yeah. And so before we kind of switch gears talking about stroke, is there anything that you want to leave the audience kind of with, people that are listening, regarding heart attacks?
Sure, absolutely. Especially as we get a little older, it's very important to get a primary care doctor to kind of prevent some of these things and make sure you're getting plenty of exercise. And a lot of people have family history of heart disease, and high blood pressure. They can get on medication early, in their 30s, instead of not seeing, especially men, not seeing a doctor till they're 50 until I have a big heart attack and they had a problem that could have been prevented. Another huge thing is smoking. That's a very big thing, and that's a risk reduction. And exercise, getting plenty of sunshine and running around.
Yeah, I feel like the running theme of podcast episodes has been primary care physicians.
Absolutely.
For any specialty that we've talked with, it's if you have this in place early on, and it's a tough thing. My wife and I even have the conversations all the time. Like, she just got one because she was like, I think I need this, and we should do this, and I'm reluctant, but that's just the way it is. But I mean, it's the underlying theme of most every podcast that we do is primary care physicians in place for a longer term kind of helps prevent future catastrophes potentially.
Absolutely. And you have great primary care doctors associated, in Cullman Regional Medical Group, and there's some other great primary care doctors in the area. So we have plenty of resources, and I'd really highly encourage you to get a primary care physician.
Yeah. And so transitioning to talking a little bit about strokes, it's still a very urgent sort of a call into the hospital. Hey, we think this patient coming in by ambulance has had a stroke, or someone in the ER comes in. What happens to your body during a stroke, and kind of what makes it such a timely thing to be addressed?
Absolutely. It's basically decreased blood flow to the brain. That's the long and short of it. And it can cause some things such as slurred speech, or inability to, use your arm or leg or speak, and those sort of things. Biggest thing for stroke is there's some treatment that we can do, especially within the first 4.5 hours of symptoms. We can give basically a clot buster medicine if you meet the qualifications for it. So it's kind of time as tissue, kind of same with a heart attack type thing, but we really want you to get there quickly. Again, this is, if you have slurred speech or difficulty speaking, numbness in the arm and leg, those are things that need to come to the ER, 911 type calls instead of an urgent care.
When you see a patient that maybe comes into the ER, they didn't get brought in by ambulance, they kind of come in on their own will into the ER, either like a family member brings them, or they come in themselves with kind of experiencing stroke symptoms. What are the tests that you run, or what is the sort of the criteria or the steps involved with diagnosing, hey, this is a stroke, or this might be something else?
Sure. And we're really good in the emergency department. Our charge nurses who are kind of in charge of the ER of the day, and our triage folks, they let the attending physician know that someone may have stroke-like symptoms. And it may not be that, but we will go see them really quickly. That's a very high priority for us. We'll go see them, do a physical exam to check for a few things. And a lot of times we'll obtain a CT scan, which is a scan of your brain, really quickly throughout the hospital course. So that's kind of how that transpires.
And so if a stroke is confirmed either by a patient coming into the ER or an ambulance bringing somebody in, what is sort of the treatment process for a stroke patient? And is there sort of a severity of the stroke, or the time that it's taken that patient to come in with symptoms that determines sort of the treatment process?
100%. So biggest thing is we want you to come as quickly as possible, because there's some basically clot buster medicine we can use within a certain time frame if you qualify. And that's why we always, time is tissue, and that's why a 911 call is really important. There's a lot of treatment available if we get to you quickly. If it's outside of a certain time frame, we obviously will still admit the patient to the hospital and get some other provocative testing, which will include like an MRI of your brain and some other tests. But if you wait too long, you can miss out on some treatment opportunities that could really help your care.
So how well does Cullman Regional's ER perform on the quality metrics related to heart attack and stroke care in the ER?
Yeah, we're very fortunate. We have a great group and do great in both of the metrics. We do excellent care in both. Specifically on this topic of stroke, the last couple of years we've done a really good job about quickly seeing people. Even if one of the nurses in triage is kind of questionable, is this a stroke? Is it not? They just come get the physician, and we work as a team and sort it out very quickly.
Yeah. And so as we kind of wrap up the conversation, what is one thing that maybe you would want the audience to gather, maybe that helps prevent a stroke or a heart attack prior to even entering the ER?
Absolutely. And this kind of goes back to, the importance of having a primary care physician. They can, lead off a lot of these things and screen you for multiple things and check out your family history and say, hey, I've been smoking cigarettes since I was 20 years old. I need to work on that. That's a huge preventative risk factor for stroke. Hey, my blood pressure's high. My grandfather's blood pressure's high. Everybody in the family had high blood pressure. Putting on some blood pressure medication, increasing the exercise, weight loss, those sorts of things are really, big deal for us. So smoking is, I've said that a million times today. It's a big thing for prevention of heart attack and stroke.
So I appreciate you being here today. We'll have information in the episode notes, kind of giving people more follow-up stuff where they can find out more information about anything that we've talked about. And if you're experiencing any of the things that we've talked about, or somebody that maybe is more prone to maybe having one of these things, educate them on kind of the ways to prevent it and the ways to kind of be aware of what to expect before, something bad does happen. But I appreciate you being here.
Yeah, thanks for having me.